I'm James Vickers. I'm the Director of the Wicking Dementia Research and Education Centre in the College of Health and Medicine at the University of Tasmania. This new collaboration is a significant development for Tasmania because it brings the opportunity for the health sector, for health consumers and the university to work really closely together in trying to have a positive impact on the health of Tasmanians across the state. The collaboration brings a great opportunity for us to translate evidence into practice. We now know quite a lot about a number of different health diseases and conditions, and that literature and that evidence has been building really over the last couple of decades. What's really important now is we look at how that evidence might be applied to provide a positive benefit to the health of our community, in particular in Tasmania. And the collaboration gives us all the opportunities to work closely with the main players in health, the health service organisations that are involved across the state, as well as with health consumers, and then also the researchers, so that we can manoeuvre and plot our way to make sure that evidence gets translated into practice. So there are many not so great health statistics about Tasmania. We have high rates of many adverse health conditions and chronic illnesses, much higher than most other states and territories. So it really is timely that we all come together to see how we can tackle some of these burning health issues for Tasmania, and the collaboration brings together partners who are involved in all and across every aspect of health in the state. So hopefully that provides us an easy pathway to implement some research that is useful in terms of health outcomes. It really is a golden era for medical and health research across Australia, and even here in Tasmania we have a lot of active research groups that work across many of those health areas that are important for Tasmania as a community. And so what the collaboration brings us is, again, it's this wonderful opportunity to, in a way, focus and perhaps redirect to some degree some of that expertise around research and the implementation of research and translation into practice, so that we are much more focused on doing research of impact, and that will bring real benefits to people throughout the state. One of the great challenges facing Tasmania is the general ageing of the population. So our average age of our population is much higher than it is for other states and territories throughout Australia. And that's a good news story. That means that good public health means increased longevity. People are living into much older ages. But as we have more of our population live into those older age groups, a greater proportion will be exposed to conditions such as dementia. And having the Wicking Dementia Research and Education Centre here based at the University of Tasmania involved in research, then the collaboration will give us great opportunities to translate our research, for example, into the cause, prevention and care of dementia, into direct benefits for people with dementia living in the state. So on one hand, this could be about trying to improve the capacity for people to live with dementia in their own home, and give them all sorts of, opportunities to be involved in the general life of their wider community. But also, if somebody should happen to need to go into residential care, we're undertaking research that is looking to try and improve and boost the quality of care that you might get in that sector as well too. So we are very much looking forward to how this collaboration can help us disseminate the latest evidence and really translate that into new practices around aged care, and particularly in the care of people with dementia.